Hello, I'm Dr. Bruce Ribner. I'm the Medical Director for the Serious Communicable Disease Unit at Emory University Hospital and one of the principal investigators for the National Ebola Training and Education Center, otherwise known as NETEC. The Ebola virus outbreak that ravaged Western Africa from 2013 to 2016 resulted in more patients infected with the virus and more patients succumbing to that infection than all the previous outbreaks of Ebola virus disease combined. By the end of the outbreak in 2016, 28,000 patients had become infected with the virus, and over 11,000 of them had succumbed. The involvement of the United States in the Ebola virus outbreak ratcheted up dramatically in August of 2014, when it was announced that two healthcare workers who had been caring for patients with Ebola virus disease in Liberia had in fact themselves become infected with the Ebola virus and were being evacuated to Emory University Hospital for definitive care. Ultimately, we successfully treated those two individuals and they were discharged. During the course of the outbreak, we would treat an additional two patients who also, fortunately, were successfully treated and discharged. Other patients were brought back to the United States to other healthcare facilities for Ebola virus infection. During the outbreak, 4 individuals were diagnosed with Ebola virus infection while in the United States. One of them was a gentleman who had recently come here from Liberia and was in Dallas when he became clinically ill. 2 individuals were nurses who cared for that patient in Dallas and unfortunately became ill while caring for him. And finally, there was a healthcare worker who had come back from West Africa to New York City when he developed illness after being admitted back to the United States. In response to this outbreak, in December of 2014, Congress passed an emergency appropriation to supplement funding to build a healthcare system and adequately prepare healthcare facilities to respond to Ebola virus infection in the future. Part of that funding was devoted to the establishment of the National Ebola Training and Education Center, or NETEC. The mission statement for NETEC was to increase the capability of United States public health and healthcare systems to safely and effectively manage individuals with suspected and confirmed infection with special pathogens such as Ebola. Others of these funds were used to establish, for the first time, a tiered approach to the management of patients with Ebola and special pathogen infections in the United States. The tiered system begins with all frontline facilities which see unscreened patients in the United States, be they provider offices, clinics, or emergency departments. Such frontline facilities are firstly charged with immediately identifying individuals who might be infected with Ebola or another special pathogen, to rapidly isolate these individuals once so identified so that they do not transmit infection to others, and finally, to know how to contact their local health department officials so that these patients can be transported to facilities where they can be appropriately assessed and treated. The next part of this tiered system consists of assessment facilities. And such facilities have the laboratory capability of determining whether somebody is infected with a special pathogen such as Ebola. But equally importantly, they have the laboratory capability of making sure that they are not infected with another infectious disease, such as malaria or such as typhoid fever, which can, if anything, be more rapidly fatal than one of the special pathogens. Once an assessment facility decides that a patient is infected with a special pathogen, such as Ebola, they then transfer the patient to a designated treatment facility And such facilities have the capability of treating patients for the duration of their illness. Now, as part of the establishment of the Ebola treatment centers, each of the 10 Health and Human Services regions had a regional Ebola and special pathogens treatment center established. These regional centers have additional funding so that they have resources and training capability to manage the sickest of the patients who are infected with a special pathogen. They are also charged with supporting other healthcare facilities and public health officials within their respective regions to add support for the care of patients and the establishment of policies to manage patients who might have serious communicable diseases such as Ebola. In the next part of this presentation, Dr. Colleen Kraft, who's the Associate Director of the unit at Emory University Hospital and a principal investigator for the NETEC, will be discussing the functions of NETEC as they relate to the American healthcare system. Thank you.
Thanks, Bruce. I'm going to continue to talk a little bit more about the work that the National Ebola Training and Education Center is doing. As you can see here on this map, we have 10 regional centers total. There are the 3 core institutions that make up the National Ebola Training and Education Center, in addition to 7 other regional centers in this network. And these are all in the 10 HHS regions that go across the United States. We have a number of things that we were contracted to do in the National Ebola Training and Education Center. You can see some of them listed here, and you'll see more on the next slide. So we were the first point, which was to create, conduct, and maintain a suite of on-site and online educational courses and helpful resources and tools. And so you can visit the www.netec.org website to find out more about these and utilize these at your own institution. We've also developed this repository for resources, announcements, and links, as well as exercise templates that can be implemented locally in your institution. These can also be found on our website. We provide physical and also remote technical assistance to healthcare systems and partners. We go all over the United States speaking at conferences or providing blueprint help, specifically looking at different areas to support biocontainment units or just the readiness for special pathogen care in local healthcare systems. We also have created this infrastructure that I just showed you on the previous slide, but there's a lot of best practice sharing and information sharing throughout these 10 regional centers across the United States. We have also spent many years creating and updating our readiness metrics. So these are metrics that we may go in and do consultation with for a particular site that's trying to assess how ready they are to accept a patient with a special pathogen. We also do peer readiness and assessments using these metrics at the regional network that I just showed you on the map, as well as state Ebola treatment units, also known as ETUs, and assessment centers as well. We basically tailor and use these metrics, and then we apply them to the site that we are on, and then we give feedback verbally at the time of the site consultation, and then there's also feedback that happens later in a teleconference. And again, just looking at this map, we have institutions spread all over the United States that we visited and performed these peer readiness and site consultations. We also have an online repository. This has been going for about a year, and this is a number of just resources that are available from the scientific literature, from protocols across the United States. And this is also available in a couple of languages in case you have partners that speak a different language. The National Ebola Training and Education Center is also involved in a number of training type exercises, simulations, and just formal didactic trainings. One of the national exercises we participated this year was called Tranquil Terminus, and this was funded by the Assistant Secretary for Preparedness and Response, the ASPR, and this involved transport of patients or fake patients, basically from assessment centers and state Ebola treatment units to these regional network that I've shown you on the previous maps. We also do, in addition to some of these exercises that may be regional or national, we also do trainings a couple times a year so that individuals from healthcare systems can come, undergo some didactic training, but also participate in breakout sessions related to their areas of interest in healthcare readiness. We also do a special kind of training called simulation training, where you actually get to work in your personal protective equipment on a mannequin, so you can kind of figure out how things are going in that personal protective equipment while you're doing procedures on a mannequin. So please join the conversation. We're really interested in sharing all of the work that we've done over the last 4 years under this contract. We have a number of different ways you can engage in our resources. So please let us know how we can help you.